Hello, my name is Matthew Clee, and I am going to be talking about brainstem strokes. A stroke is when the blood supply to a part of the brain is blocked or reduced, stopping the delivery of oxygen and nutrients to the brain cells. A brainstem stroke is a stroke that occurs in the brainstem, which consists of the midbrain, pons, and medulla oblongata. The older you are, the higher the risk of stroke. But people under 65 can still have strokes. Those at risk include people with a family history of stroke, prior stroke, transient ischemic attacks, TIAs, or heart attack. Women have a higher risk of stroke due to things like living longer, oral contraceptives, and pregnancy. African Americans have a much higher risk due to their higher risk of having high blood pressure, diabetes, and obesity. High blood pressure, smoking, diabetes, and your diet all have a significant effect on the increased risk of stroke. Socioeconomic factors, alcohol abuse, drug abuse, and sleeping habits can all increase the risk of stroke. Strokes come in two main categories: ischemic and hemorrhagic. Ischemic strokes are when a vessel supplying blood to the brain is obstructed, and a hemorrhagic stroke is a weakened vessel that ruptures and bleeds into the surrounding brain, accumulating and compressing the brain tissue. Ischemic strokes are broken down into two subcategories: cerebral thrombosis and cerebral embolism. A cerebral thrombosis is when a clot forms in an artery supplying the brain, and cerebral embolism is when a clot breaks free from a vessel, usually around the heart or large arteries of the upper chest and neck, moves through the circulatory system till it reaches the arteries in the brainstem. Hemorrhagic is also broken down into two subcategories: intercerebral and subarachnoid, which are defined by where they happen. The central nervous system is the primary system affected by a brainstem stroke. The brainstem controls all basic activities of the central nervous system, which means that a stroke in this area can affect consciousness, blood pressure, breathing, and all the motor control of the body. It can even do so much damage that the patient suffers from what's called locked-in syndrome, where they are only able to move their eyes. Treatment for strokes is highly dependent on how fast it is diagnosed. The faster a diagnosis is made, the better the chance of recovery. Treatment options also depend on which type of stroke has occurred. For ischemic, it is a matter of dissolving or removing the clot, and for hemorrhagic, it is to stop the bleeding. Medications may be used to dissolve the clot or work against blood-thinning medications the patient may be on. There is also the possibility of surgeries, such as an embolectomy, a vertebral-basilar angioplasty, and stenting, or surgical evacuation of the hematoma. The best treatment for a stroke is to not have one. Preventive care measure can have a large effect on a patient's chances of having a stroke. Lifestyle changes, such as quitting smoking, having a healthy diet, control of high blood pressure and cholesterol, and control of medical conditions that increase the risk of stroke can greatly reduce a person's chance of having a stroke. For both types of strokes, prognosis is dependent on several factors, including the severity and location. And while the chances of death are not overly high, it does happen. The speed of diagnosis and treatment have an influence on the recovery of a patient. The faster the better. Patients can fully recover from a stroke, though some lasting impairment is possible. The consequences of a stroke can be severe, and long-lasting but fast medical help can lessen the effects and increase the chance of recovery. While strokes are survivable, the best defense against them is to prevent it from happening. Preventive care, lifestyle changes, monitoring medical conditions, especially high blood pressure, are some of the most effective ways to stop strokes before they happen. Learning about strokes, like the signs and risk factors, especially when you have a family history, is a smart way to help you prevent them from occurring.